everyone. Thanks for joining me and for hanging on for this conversation about diode laser use in your operatory. So thanks for that intro, Joe. Just wanted to share a few pictures with you guys from some of the opportunities that I have had throughout my career. So like Joe mentioned, I have worked in telehealth and teledentistry settings. So as you can see here, I'm working on kiddos in a little portable, and I'm over here with my Nomad. What you don't see in the background is that some of these classrooms were, this one was where they stored their PE equipment. This one over here was where there was like drums in the background. So I have had the opportunity to work in lots of public health settings, this being one of them. And when I'm not educating about teeth or learning about teeth, I'm hanging out with my buddy Einstein. That's this little guy right here. And yes, he was named after the Albert Einstein. I mean, they have an uncanny resemblance, don't they? So hanging out with my buddy Einstein, and sometimes he lets me brush his teeth, and when he doesn't, he has to go somewhere else to go have them cleaned. So it's just a little bit about me. But like Joe said, I've been practicing hygiene for about 11 years, and of those 11 years, 10 of those have been using a laser. So happy to be here today and share with you guys my experience with laser use. So a little bit about our course objectives for today. Basics of laser use, and we're going to go over some scientific reviews, some literature that supports the evidence of laser use. We'll review oral systemic connection and how that affects our patients, and how laser has an early interventive method for preventing that oral systemic connection. We'll also talk about integrating clinical care and how we can apply the lasers into our hygiene operatory. And then we will also touch base on ways of diversifying the operatory, which can also in turn have some impact on our return on investment. So we'll briefly talk about those things. Really want to give a major shout out to the following clinicians that are listed. Because of them, they've allowed us to showcase their work, and we use a lot of their videos and photos throughout our presentation. So shout out to all of our wonderful clinicians on here. So let's dive in. And why do we need to use lasers? I think of, when I started out, traditional modalities that maybe existed when I started out in hygiene, some of them we're not using today. And, I really want you guys to think about how are your treatment outcomes with the treatment paradigms that you guys are providing now. Are you okay? Are you at about 75 to 80% of your treatment outcomes? Or is there somewhere where you want to improve a little bit more on those outcomes? So rather than being in that, this is good enough, 75 to 80%, I'd really love to have everybody elevate those outcomes from their patients. And I think of the advancements that we've had in modern science and modern medicine that use laser. For example, I think for a lot of our patients, they're very familiar with LASIK eye surgery, which I clearly have not had because I'm still wearing my glasses. But I think of those kinds of advancements that have been made in the medical field. And with our patients being more familiar with medical uses of laser, I'm hoping that this helps them think outside of the box, not only for our patients, but also for us as clinicians, where we could elevate the standard of care that we are providing to our patients. So, why use lasers? I guess you could say that you don't necessarily have to use lasers. You can certainly keep on treating your patients with these same modalities, but are you getting the results that you want to see? So the world we live in today has problems that cannot be solved with the same thinking we thought when we created them. So that just, it puts the opportunity into my hand to transform those patient outcomes. Patients that are healthier, easier to maintain. And I think that's our goal for most of us as clinicians. We want to maintain those healthy patients. So again, think of all the technology that has occurred in dentistry. So I've been in dental since I was 17. I'm not going to tell you guys how old I am now, but I've been in dental since I was 17. So I did have to use these little dip tanks before, and I would get it all over my smock. So I think about things like that. We have, thank goodness, we have digital radiography now, and that has cut down on the radiation that our patients are exposed to, not only for themselves, but us too. So I think about these kinds of modalities. Could I take an FMX, with analog film? Sure, I very much could, but do I want to? No, I don't want to. And that's going to be really time consuming. And also, it's not a benefit to our patient. Things like alginate. Yes, they still serve its purpose for alginate impressions, but we do have things such as scanners nowadays. So think of all of the technology that you have experienced throughout your time as a practitioner. It's kind of like using a manual toothbrush and an electric toothbrush. On occasion, yeah, I'll pick up my manual toothbrush, but for the most part, I have completely switched over to electric because science supports that it does a more efficacious job. So just think of it that way. It's improving our patient outcomes. So common question I get is, can a hygienist use a laser? So it's kind of a topic that you have to dissect. But one of the things that I would say is most states don't regulate and have regulatory or prohibitive language against laser use. So I would really encourage you to visit your dental board and check out the level of supervision. Can you use a laser under general? Does it have to be under direct? Sometimes there's certain wording in regards to the type of laser that you need to use, or maybe even procedures that need to be performed. So I'll read this off to you guys. Regulations governing the practice of dentistry, including lasers, will vary in each state or province. Review any statutes and regulations regarding emerging technology use in your state or local laws, or contact your local licensing board. So the takeaway from here is know your scope of practice, but also visit your dental board and see if it is something that is allowed. So again, the reason why we want to implement the lasers is the laser use is going to be adjunctive care. So sometimes I get questions from new laser users, and they say, so am I removing calculus with this laser? Do I still need to use my ultrasonic? Am I still doing my hand instrumentation? The nice thing about laser use is you are going to be doing, you can treat your patients however you want, whatever implemented protocols you already have. You don't necessarily need to change those. It's going to be adjunctive care, meaning we've taking care of this hard tissue component over here where we have buildup, calculus. We're taking care of that when we're doing our hand instrumentation and our power instrumentation. What about that tissue? What about that bacteria that gets embedded into the tissue? Or sometimes we see people on, repetitive perio maintenance visits, and we might not be seeing the gingival results that we want. So that bacteria that is found on the root surface can get embedded into the adjacent tissue. And that's where we can have more non-surgical periodontal therapy supported cases that are supported by laser that improve our outcomes. So let's get into what is a laser and what do we use it for? So a laser is actually an acronym for light amplification by stimulated emission of radiation. Okay, so that is what a laser stands for. And yes, there is light that is being used. There's light energy that is going to be transferred into the tissue. And there is a bit of radiation that is going on. The reason I'm bringing this up is most of the time when I am trying to talk to patients about laser, their common question or concern is it going to hurt me? And is it safe? And we have been using lasers in dentistry since the 1960s. I think that was with Dr. Maiman, who started with the ruby laser, which sounds like a very pretty laser, but also probably very expensive. So the laser systems that we have used from the 60s till now have evolved. Diode lasers in particular have become more affordable, even so that hygienists themselves who are in practice could purchase them now. So laser use has evolved, and just want to make note that yes, there is light energy that is coming from the unit and it's being transferred into the tissue, and that's going to create a thermal reaction within the tissue. But I did want to mention that yes, it is safe to use. So a few of the benefits from laser use. you're going to be getting this energy and it's going to be delivered in the form of light. So that is coming from your diode laser. You're going to take the energy that's being generated from this little guy here, and we're going to transfer that into the tissue. So if we think back to, microbiology and all the science classes that we had to have, I think of, what were the ways that we were destroying or trying to kill bacteria? There was mechanical ways, there's chemical ways, and obviously there's thermal ways. There's thermal reactions that we can cause within the tissue so that it eliminates the bacteria that's in the pocket. So that thermal reaction is going to be what causes the bacteria to apoptose, okay? That light energy is going to be absorbed in the tissue, and the laser works because it is seeking out pigmented chromophores. And those two pigmented chromophores that I want you guys to get familiar with is hemoglobin and melanin. So the laser knows to seek out those particular pigmented pathogens and leave the healthy tissue alone. So diode laser therapy has been proven to reduce inflammation, pain, bacteria, and it stimulates wound healing while leaving those healthy tissue intact. And the reason it knows to leave the healthy tissue intact is based on wavelength and also the hemoglobin and melanin aspect, where it is seeking out those pigmented components. So biofilm, I want to talk about biofilm a little bit. Biofilm control is imperative in preventing inflammation, right? So the way that the laser is working is it's going to be seeking out those cellular structures. It's going to unglue the cell walls from some of the bacteria, which is going to keep the biofilm from accumulating. So our objective, of course, is to eliminate periodontal pathogens throughout the oral cavity. And we do so with the laser and its anti-inflammatory effect. So just want to read this off. And if you guys want more information or want to do some more research on your own, a great place to start is Moritz. If you look up Moritz, they have a lot of studies that they did on diode lasers. So the diode laser reveals a bactericidal effect, and it helps to reduce inflammation in the periodontal pockets in addition to scaling. The diode laser therapy in combination with scaling supports healing of the periodontal pockets through eliminating bacteria. So let's talk a little bit about laser physics and what is going on when we step on the foot pedal for our laser. We are getting tissue interaction that is going on. So the STAR acronym refers to scattering, transmission, absorption, and reflection. So when you are working with a laser, just want you to be cognizant that you aren't using reflective surfaces, meaning if you are using your mouth mirror, it's usually going to be solely just to retract. The target is the tissue. You want to make sure that you get that laser energy from your unit into the target tissue. So you want to make sure that it's just directed right where you want it to go. Otherwise, that energy keeps going until it hits something and you want it to go right to the source, which would be our tissue. So I talked a little bit about radiation, a little bit about light energy. So the light energy that is coming from our diode is a little bit different than regular light. Regular light is not monochromatic, it's not coherent, and it's not collimated. It's a little bit more spastic. So it's a little bit difficult to control. So with this laser light energy, there is radiation involved, but the laser light is non-ionizing and it doesn't produce the same effects as attributed to X radiation, which is that shorter, high frequency wavelength. So for us, for our diodes, the energy that's coming out of the diode is going to be measured in a wavelength. So that's what a wavelength is. It's what the height of one crest to another. And here we have different types of wavelengths. So our diodes are here within the 810 to 980 nanometer. I did list here our erbium chromium YSGG laser. That is our all tissue laser. So the lasers that we will predominantly be talking about today have to do with diodes or soft tissue lasers. So what I want you guys to know from here, the takeaway is these longer wavelengths okay, that are in the near infrared are not going to be entering the nucleus. So this is really important communication for our patients. So we let them know that it is safe for them to use. These shorter wavelengths, those X radiation type of X-rays, those are the ones that can cause damage when they enter the nucleus. So I want to talk a little bit about how wavelengths and tissue reactions, how it all kind of fits together. Um, there are biological effects that happen to the tissue. Now, the nice thing about the laser that we use is they are presets on it. So these presets are like a baseline for you to start off of. One thing you'll hear a lot of people have been using laser is you have to know how to read the tissue or let the tissue kind of talk to you because it'll tell you what it needs. If we have more hypertrophic pigmented tissue, that's going to respond a lot easier to the laser, right? Because it's that pigmented bacteria, you know, our friends P. gingivalis, P. intermedia, that darker pigmented bacteria. So when we have that infected tissue, that laser, that chromophore is going to seek that out. Biological effects are also dependent on the power density, and I'll talk about that a little bit more about the output of the laser. And then, amount of cooling. We always have to use our HVE when we are using our laser. We'll talk a little bit more about wavelength specific lasers, and then we'll talk a little bit about duration of exposure and how quickly or how slowly we're moving when we are working with a laser. One thing I will say about laser use is it's a little counterintuitive to what we normally do as clinicians. When we are working, we're really trying to work really fast, really quickly, and get out of there, right? We're trying to turn over our patients. When it comes to laser use, it's a little bit more of a slow and steady wins the race. But as you get used to using your laser, you'll find you'll be able to read that tissue and you'll be able to look at things like your power setting, your duty cycle, meaning is the laser on the whole time that you step on the foot pedal, or is it broken up so that you're not getting a lot of thermal energy into that tissue? And we'll go over a few of those performance factors. So there is safety issues that are a concern, and we have to have safety precautions when we are using our laser. I talked about wavelength. It's important to know what wavelength your laser is. It's also important to know that because of the safety glasses. So all of the units come with safety glasses that you wear when you are treating patients. And these are very specific to the wavelength that you have your laser, and they're usually on the left side of the glass. You can see what wavelength they cover. It is recommended that you use a class 3 filtration mask, and then you have signs that are up and that they get put up and then get taken down when the laser is not in use. I went to go visit an office and they had theirs right up. There was somebody working in the room so that you would know not to go into the room without protective equipment over your eyes. I haven't known anyone, I'm gonna knock on wood, that has had any retinal damage, but you do want to be very, very careful and take your precautions when you are working with your laser. You have to have safety glasses for yourself, for the patient, anybody that's in the room. We always test fire our laser before we begin, meaning just kind of take a surface and see if the laser is operating properly. Like I mentioned earlier, HVEs are used for all laser procedures, and there's usually a laser safety officer appointed. Again, depending on what state you live in, certain states require that you have a laser safety officer that has certain compliance measures or certain training involved in order to be the laser safety officer. Two more things that I will mention is avoiding alcohol-based products when you're using a laser. You don't want to use any alcohol-based products to clean the unit, and then you don't want to use any alcohol-soaked gauze when you're using the unit as well. And then you want to stay within your nominal ocular hazard distance. So laser safety officer that's going to be in your office should know what that distance is. And all that distance is saying that there's like a safety parameter. If you're within that perimeter, you need to be wearing your glasses. If you're outside of that boundary, then you don't need safety glasses. So just a few little tips on how to be proactive and how to ensure that everyone in your office is laser safe as well as laser trained. So let's get into a little bit more of soft tissue components. Half of our population has some form of perio disease. So with the AAP and their guidelines, the new guidelines, periodontal health should be achieved in the least invasive and most cost-effective manner to the patient. So now with laser use, we're able to treat both components, like I described earlier, treating the hard tissue component as well as the soft tissue component. So with that, we're able to provide the optimum standards of care for our patients. So this is a picture denoting here someone who had laser treatment. So they obviously had their prophylaxis done, but they also had laser bacterial reduction done. And you can see that there is less inflammation along the gingival margin. So with this also, I just want to make sure that you guys are really on top of your perio diagnosis and that you're comfortable diagnosing things early on. Because the earlier on that we can treat things, then we'll have better optimal responses from our patients. So oral systemic connection, another great way that the laser is helping us, it's kind of breaking that chain of infection with some of our patients. So we know that perio disease is a biofilm-induced bacteriological infection, and depending on the host's systemic response, whether it be chronic or acute inflammation, that's going to all depend on the host and their reaction to biofilm, endotoxins, and calculus. So whenever that creates an environment for inflammation, if left untreated, that can destroy connective tissue and cause eventual loss of teeth. So the stimulation of the inflammatory response, that's largely responsible for destruction in perio cases. So what we want to do is explain to our patients that the mouth is a portal, okay, and that any bacteria that's in our mouth can end up in other places in our body. So we know that as clinicians, but sometimes making that connection for the patient and letting them know that they're getting specialized treatment and specialized care with their conditions in mind, that really helps to improve their outcomes as well. Talk to them about things like P. gingivalis, which we're so familiar with. Some of them don't know that it's the same bacteria that they find in arterial plaque and rheumatoid arthritis. So that's an important concept to hit home with the patients, because then they understand that what you're doing is trying to break that chain so that it isn't left undisturbed, and so that periodontitis doesn't become a chronic inflammatory disease. So what we're doing with the laser is helping to stop the spread. I really like this visual because what happens in your mouth isn't just going to stay in your mouth, right? Whatever bacteria is going on in there, it can end up in other places. I will say that a positive thing to come out of COVID was that patients were a lot more aware about aerosols and inflammation. And they were a little bit more understanding as to why I was using the laser. I was only off for about a month for work. I was using the laser as a pre-procedural to decontaminate the gum line. So that gave not only myself, but my patients, the confidence that I was treating them with the best that I could with my abilities, because I wasn't creating a lot of aerosols. I would use my laser and then I would still use my power instrumentation, but I felt confident that I didn't have all these particulates in the aerosols because I'd already gone in and decontaminated the sulcus. So lasers are a great pre-procedural way to mitigate the risk of aerosols. So let's get into soft tissue benefits. Benefits that we see from laser use are decontamination, again, of the gum line, because you are reducing the bacteria that's in the gums. You're going to get a reduction then in tissue inflammation. This will lead to more predictable outcomes. It also leads to greater potential for regeneration. It's going to prevent further tissue destruction. It aids in reduction of biofilm. One of the great things is that on a cellular level, we know that it stimulates fibroblasts. And if we can think back to histology, microbiology, fibroblasts are the foundation for collagen. So that is very important to help support our gums and our gingival structures. So all of this is also a holistic way of reducing patient discomfort. There are reported analgesic effects from laser use. So if that is decreasing patient discomfort, that means that we're also providing less medicaments for the patients, prescribing them less painkillers. Another therapeutic effect is photobiomodulation, which is a very long word, but it is basically low level light therapy. That was the old term that used to be used. But you get really good photobiomodulation with the Epic X and the TMJ1 that comes with it. So again, we talked about holistic effects, right? We want to see laser therapy as a holistic, modern alternative. You know, I work in California, and I used to work in Claremont, California, and it was there's a lot of PhDs in Claremont, very health-focused community. So a lot of the population really just wanted more holistic, overall, more health benefits that they weren't really trying to rely on antimicrobials, antibiotics. So they wanted more of an alternative as to having prescription medication. So CDC has said if antibiotics and antifungals lose their effectiveness when we lose the ability to treat infections and control these public health threats. So if we lose the capabilities of antibiotics because we tend to overprescribe, we can certainly look at the laser as an alternative to these prescriptions. So laser use for pain management, as I mentioned, there are holistic benefits to the laser. It is non-toxic, it's going to reduce inflammation, and it does have analgesic effects, and it helps to accelerate wound repair. And then in a 2013 study, they took 32 patients that had recurrent aphthous ulcers, and they took pain scores on these patients. So taking the pain score immediately after the diode use, most of them had a decrease in their pain score, meaning if their scale of pain was around 10 to an 8, it could have gone down as far as maybe about a 4. So even after one single use, there was a dramatic drop in the pain score for these patients. So this lets us know that laser therapy reduces pain and helps eliminate the need for medicaments. It's just another way of looking at the laser and its benefits that it could bring to your practice. A comparison that I like to make is also linking it to things like minocycline. You know, there is a price that comes along with that, and it can be a little bit more expensive for the patient to use because usually you need it per site versus, you know, you're using quadrant or full mouth for a laser tip. For lasers, you don't have a minimum depth of penetration, and it actually has a deeper penetration into the epithelial tissue, and the wavelengths for these lasers can go up to 1100 microns, where we have, you know, sometimes the penetration depth on some of these medicaments can be a little bit more shallow, anywhere from the 300 to 400 range. There's also, you know, talked about fibroblasts a little bit. Chlorhexidine. If some of you guys are still using chlorhexidine, studies have shown that chlorhexidine has inhibited gingival fibroblast proliferation and attachment, which we need more of that. So you would actually be providing that therapeutic effect to the gingival tissue when you are using the laser. And from this study, an application of diode laser use in the reduction of targeted periodontal pathogens, PG, PI, TF, and TD were significantly reduced in the sulcus for up to 90 days. So whoever can spell all of these correctly gets extra bonus points for tonight. You can just drop it in the chat and have Joe figure it out. So we want to get to the Epic Hygiene laser, which is finally our hygiene laser designed by hygienists for hygienists. So this is the laser that we use in our hygiene op. And it was released, I think it was like 2020. So right along the height of COVID. Really important because it is portable. I showed you guys the little unit. So if you are working out of multiple operatories, you can, oh, disappeared. You can take it with you in a little cart. But what's really cool about the hygiene laser is its simplicity to use. It is plug and play. And even though it is plug and play and is very easy to use, it is a class 4 medical device. So you do need training on it. And again, check your states. Every state has different training for laser use. But I do want to mention that it's the only hygiene laser approved for FDA. It is FDA cleared for laser bacterial reduction. So we had a lot of our hygiene faculty that gave a lot of great feedback in regards to settings, function, and even, you know, so much as the ergonomic design of the handle. So we'll get into the soft tissue components now and how we would be using these lasers in our operatory. So we have a few settings that I want to talk about. One, we would use it for laser bacterial reduction. Sometimes it's called, referred to as pocket therapy or the pocket therapy setting on the laser. We can also use it in adjunct to our non-surgical periodontal therapy cases. So this would be LAPT or laser assisted periodontal therapy. We would also use it for desensitization of aphthous ulcers, herpetic lesions as well. And I want you guys to keep these two things in mind because even though it isn't an indicated procedure, desensitization has also been a huge benefit. Clinicians have been using it on their patients in a desensitization setting, which is the similar setting for the aphthous ulcers and herpetic lesions. And we also get hemostatic effects from the laser use. I want to briefly talk about the Epic X. So the Epic X is another soft tissue diode that comes with these two little attachments here. This one is the whitening wand. So you don't have to buy like a whole nother thing that sits next to you in the chair. You have it all here with you with your laser. So it's the whitening wand. And then we have the TMJ wand or pain therapy wand, which you can kind of put over the masseter area or the temporalis, depending on where your patient is experiencing pain. So that's where that photobiomodulation, that PBM or low-level light therapy is coming from. So even though we have all of these indicated procedures, I know we're not going to be doing gingivectomies, troughing, that sort of thing, but it really is important to know these functions because sometimes this can be like an introductory laser to the office, meaning maybe doctor's going to be using it and then so will hygiene. So it's important to know all of the procedures that can be done with this. So then we can, have doc look at it and say, I see these, patient has these complaints or these concerns. I know that we're not diagnosing, but we definitely help to identify cases for our doctors. So there's lots of surgical benefits that do come from the laser. With that being said, I do want to say that the laser can be turned into a surgical instrument. That tip has to be transformed. But depending on needs, you can use it for hygiene and for surgical procedures. The laser can act as a cutting instrument or a vaporizer of tissue when it comes into contact with tissue after it has been initiated. So in a 2018 Italian study that removed pyogenic granulomas with the diode laser, they said it induced a reduced intrasurgical bleeding and a better gingival healing compared with cold blade surgical treatment. This study demonstrated that the use of diode lasers showed additional advantages compared with cold blade in terms of less postoperative discomfort and pain for surgical removal of pyogenic granulomas. So it's a lot of fascinating outcomes that patients are having because they have had laser used on on their conditions. So presets, I talked briefly about presets for the laser. It is plug and play, pretty easy to use, but you do want to be mindful of your patient's tissue. Every tissue is going to respond differently to the wavelength. It's also going to be dependent on your patient. Their severity of disease. Is this tissue very pigmented? Is it hyperkeratinized? So even though there are presets that come along with the laser, it's really important to really look at the tissue, make sure that you're not, that it's not turning black, and that you're pretty much able to adjust the wavelength with the proper chromophore present in the tissue. So you're going to be observing the tissue as you're working, even though these do come with these pretty easy to use, straightforward settings. You would mostly be adjusting your power outage here, or you can adjust the modes as needed. All right, so let's get into the fun stuff. How are we using our lasers? What are we doing with these lasers in the hygiene op? So we do use it for laser bacterial reduction. When you explain this to your patient, I would use the full term laser bacterial reduction because it tells you what it's going to do. It's going to reduce that bacteria in the sulcus. We use it with an uninitiated tip or a bare fiber, as you can see here. The light energy is getting in there. The outcome of this is going to be decontamination of the pocket. We use it in adjunct to our non-surgical periodontal therapy cases. So in this, depending on your state or province, again, you might have to use an initiated tip for debridement. In states without debridement, a bare fiber or an initiated tip is a huge benefit in disinfection. So the ultimate goal with laser-assisted periodontal therapy is you want to rehabilitate that tissue. You want to reduce those inflammation factors, and you do want to have some decontamination going on. We can also use it around implants. Important thing to note is it has to be on a bare fiber. So you don't want to use a laser on a initiated tip. You want to make sure it's an uninitiated tip. And if there are areas of bone loss, that would be outside of our scope that needs to get referred out. But the nice thing is, so in most of our cases of patients that have implants, they do tend to be top heavy and they do tend to have a lot of inflammation around the gum line. So important to note that yes, you can use the laser for that. Another way that we would use it chair side would be for aphthous ulcers or herpetic lesions. So the lesion's still going to go through its healing phase, but it does so at a much quicker pace. The immediate effect that you get chair side is desensitization of the pain, of the tingling, itching, burning. So it's really good to go over those patient health histories and see if they suffer from aphthous ulcers or herpetic lesions. And as you can see here, that's me, that's your girl. I use the laser on myself. So that was my turning point for me, was when I started using the laser for herpetic lesions, not only on myself, but on my patients as well. I was able to see the tissue heal and respond a lot quicker. Now, when I get, a lesion, they are really tiny. I've had them ever since I was a kid. And I remember like my lips being closed shut and having them be really painful for about 2 weeks. Now, this little tiny lesion that I had, I'm going to blame my coworker, Cindy, because I think she was stressing me out that day. This little lesion, I used it on a Friday, and then by Sunday, it was gone. So I'm able to see those results not only for myself, but for my patients as well. So it's pretty cool stuff. Hemostasis, you also get a hemostatic effect that comes along with all of these procedures. So I'm going to share this video. Hopefully it loads properly. So this is from one of our partners on Hygiene Edge. That way you guys can get a glimpse of it. Hoping it works.
One of the many procedures that you can do with this epic hygiene diode laser from BioLase is laser bacterial reduction, or LBR. It's a preventive procedure that is not painful, that reduces the microbial load intraorally. It can be done at the beginning or the end of every appointment. To do this, you're going to first give you and your patient the wavelength-specific protective glasses and a pre-procedural rinse. Then place and bend the correct disposable tip on the handpiece. Then when you're ready, you're going to activate the tip with the wireless foot pedal. I'm going to demonstrate first without it on so that you can see the technique a little bit better. So with the high volume suction, take the laser with an uninitiated tip and enter only 0.5 to 1 millimeter into the sulcus while keeping the tip parallel to the long axis of the tooth. Direct the tip slightly towards the gingival wall, not the tooth, like so, and use a gentle exploratory like sweeping stroke, not a probing stroke. You'll spend about 5 to 10 seconds per tooth, all while keeping that tip in the pocket at all times when it's activated with the pedal. LBR takes about 5 minutes for the whole mouth, and you'll have a reduction in those microbe levels, which helps to prevent inoculation from diseased pockets. It will stimulate new cell growth and healing of tissues for patients of all ages. This laser was developed specifically for hygienists by a dental hygienist, so it was designed to be a very versatile tool that you will get a lot of use out of for your patients in the hygiene department.
And here is a video on LAPT. So LAPT is going to be a little bit different than laser bacterial reduction. You still get that bacterial cytal effect. However, this is being used to remove that granulated tissue that's impeding new tissue from attaching. And again, this procedure can be used either before or after you do your scaling and your root planing. Some tissue is a little bit more fibrotic, a little bit more dense, so you might need to use the periodebridement setting to gain access to an area. Or if you have access, then you can use it post-procedurally to, again, get rid of that granulated tissue. I have one more video. I do want to show this one. This is one of my favorite videos from Lynn. I like this video because I had somebody tell me one time, well, if you wanted to be a periodontist, why didn't you become a periodontist? Like, look, I'm a hygienist. I'd like to take care of things early on. And this person was implying that I am altering tissue and that I'm doing all kinds of things that really is not the case. If you can see here on this anterior tooth, you're not doing anything that's irreversible. You are not doing gingivectomies. It's all within my scope. I practice here in California. So I have seen benefits like this with repeated laser use, especially being in a perio practice, seeing those patients on a monthly basis. You got to see that, using repetitive treatment on those areas really helped to rehabilitate that tissue. So I really like this video that she took. And then this is an example of how we would use it on herpetic lesions. And this, I just want to point out that you're not coming in contact with the tissue at all. This is in a non-contact mode. So that, again, the lesions like this were my turning point with laser use because I was like, oh, I'm not even touching the tissue and it's still getting benefits from the laser. So this is one of Lynn's cases that I really like. As you see here, this one was a really juicy vesicle. Okay. And so with these, you might need repetitive treatment. Okay. This is first day that the patient's coming in. By day 3, it's pretty flaky. Okay. I'm starting to crust over. This is by day 3. Usually for patients who suffer from cold sores like these, it could take about 10 to 14 days. And you're in a lot of pain. It's itching. It's bothering you. Plus, you don't want to go out in public. Like, who wants to be seen with a herpetic lesion of that size? So this is by day 5. By day 5, this person can go out into civilization and no one's going to look at them funny. And then here is me. I don't even know how I did this, but I was getting a cold sore. So I started to get a cold sore and somehow I bit my top lip and I could already feel it. I'm like, great, it's going to start to bubble up. So I used the laser on it. This is day 2. So by day 1, by the end of the day, that tingling feeling had subsided. This is day 2. And then day 3, again, another person that can go out into civilization and not get funny looks. So really look at your patient cases, look at their health history and see if they could benefit from something like this. And if maybe it might not be cold sores, but it might be aphthous ulcers that they suffer from. So make sure you are taking a good intake of their health history. So another topic I talked about was photobiomodulation, which is the pain therapy. This is going to stimulate cellular function, proliferation, and motility. It's going to activate the mitochondria, and that's going to release nitric oxide. which is going to increase vasodilation, which creates an anti-inflammatory effect. So we're going to use that wand, and you kind of move it around the area. It can be used on the masseter, on the temporalis. Dr. Walensky on our website has a wonderful webinar that he hosted for us. So if you guys want more information on how to use this type of pain therapy one, visit us on biolays.com under resources. We have lots of webinars that are archived. This is used in a non-contact mode. Again, you're not really touching the tissue. It's not like sitting on the tissue, but it will provide some relief. So think about a lot of the same day dentistry that we're doing. You know, if the patients are sitting in our chair for a long time, or if they have to have ortho visits, you know, this can kind of help with those, you know, those areas where the patient might be in pain from being open for too long. And again, please check your dental boards for scope of practice and make sure that you are able to use this setting. Another thing with the Epic X model, it does come with the whitening wand. It is a little bit more affordable, and there is great shades on lifting. So let me just show you guys really quick how you would be using the laser unit with whitening. But again, this will only work with our proprietary laser whitening. So make sure that you're not trying to use another company's laser system. It's not going to work. All right, that was in real time. You can whiten your patient's teeth in 30 seconds. Just kidding. It takes about 20 minutes chair side time, 20 to 30 minutes. Okay. So we talked about how we can incorporate the lasers clinically. Again, do a really thorough review of health history, risk assessments, dental risk assessments for those patients. Be on top of your staging and grading. Don't be afraid to diagnose early on. Remember, we're hygienists. We are in a field of prevention. So we want to catch things early on. Don't think of it as, this is one more thing I have to do. This is going to greatly improve your treatment outcomes for your patient. As we all know, healthier patients are easier to maintain. So that is our goal. Consistency will yield results for your patients. So for our models of care in dental, we are either using the laser as a laser bacterial reduction. You can use it before or you can use it after a prophy. It depends on you and how you want to incorporate it. I have some clinicians that use it both before and after. You can use it in a therapeutic manner when you are performing a prophylaxis or working on the gingivitis cases. And whenever we are using it with our periodontal therapy cases, it's going to provide more therapeutic effects or debridement effects, depending on what you want to see for those cases. So again, think about diversifying your operatory. You know, sometimes hygiene can get a bit repetitive and we kind of get stuck in the way that we do things. Remember, with any type of laser or any type of technology that you're implementing into your op, there's always a learning curve. So give yourself that grace to learn. But like I said, the more consistent you are with the laser use, the more you're going to see those results. And I do want to add, so I have here our LBR that we can use to diversify our op. We can use it for our perio cases. We can use it for TMJ pain therapy, for aphthous ulcers, herpetic lesions. We can use it as whitening. I also wanted to mention again, desensitization. That is not an indicated procedure, but certainly one that you could use in your operatory if you have those patients that, you know, you can't even blow air because they're just jumping out of the chair. Apply a little bit of fluoride, you go over it with the laser, and this helps to desensitize those areas that have a lot of attachment loss. So one more thing to review is our potential annual revenue. I know a lot of us are wondering, like, how can I ask for a raise? If you bring up with just these three procedures, bring this up to your boss, or bring this up to if you are a dentist and you are trying to increase the value in your practice with just these three procedures, just with LBR. Let's say you had it at these numbers are all arbitrary, okay? At a $40 fee. And let's say you only had a 50% case acceptance. Okay. This is on average if you have hygiene that is, working 5 days a week. Okay. Let's say an average of 40 patients a week, right? And we're only getting about 50% case acceptance. At $40 for LBR, you could have a potential revenue of $41,600. That has already paid for your laser. Okay. You can also, let's say if we did oral lesions at, again, arbitrary number, $65 fee with just a 1% case acceptance. So this would be if you're having maybe about 4 patients a month. That's $3,120. Now here with LAPT, this is about $100 per quad. And again, it varies depending on your community and the area that you're servicing. You could have something around the neighborhood of 208,000. So these are things to think of when we are diversifying our operatory. This is just with 3 procedures that I'm mentioning, by the way. So with those 3, the potential annual revenue that you could have is $252,720. This is just, again, arbitrary numbers. It varies depending on where you work in the communities that you serve. But that tells me that if you've already paid off your diode laser, you might want to think about investing in a water laser, which is our all tissue unit. And I do want to just talk about it briefly, just because I wanted to show you guys, if we diagnose early on and we have early interventions, we can keep a lot of these patients in-house. Patients don't want to be referred out to perio. They don't want to go see them 3 months and come back to you. And then sometimes it's like, well, where am I the next month? We want to provide our patients with total office solutions that are very integrated for hygiene and DDS. This is just going to add more value to your practice, but also to the way that you are taking care of soft tissue and the hard tissue components. I also wanted to mention these water lace hand pieces are, I think it's about 98% less aerosols than traditional hand pieces. So it's something to think about. But here, as you can see, we have bifurcation. Okay, that was really involved. And here you can see a nice trabeculated bone pattern that is starting to grow back. And this is with our repair perio setting. And this is with no bone graft. Okay, so just wanted to throw that out there. We're getting close to the end of the year, and I do want to mention the if you don't use it, you lose it benefits, our Section 179 tax benefits. So that benefits small businesses, and if you need that deduction, might be a candidate for you. So just to recap, why we do laser assisted hygiene and why I do it. We have more predictable treatment outcomes. We are also managing the treatment of gingival diseases in addition to the scaling and root planing. So now we're able to take care of those 2 components. You always have bacterial reduction that's occurring. You have improved healing and decreased discomfort. So then you're offering the optimum treatment to the patient. And part of our purpose here at BioLays is to restore and repair dental anatomy, alleviate pain, but also have that pain, fear, and anxiety. We want that reduced in our patients. So with the analgesic effects that the laser provides, we're able to provide those kinds of treatment outcomes to our patients without that fear of going to the dentist. So just look at your overall cost when you are deciding on a laser. Maybe the soft tissue one is the one for you, or maybe you want to go with the all tissue laser. But once you become part of the BioLays family, we have a robust support system. We have field service engineers. We have very knowledgeable clinical educators, and our sales team, which I refer to as our laser experts, because we have a lot of knowledgeable laser experts on our BioLays team. And then what a better way than, supporting a business that is the tips and the lasers are made in America. And we also provide you with educational training and any type of support that you guys would need to implement lasers into your practice. So I'm just going to leave you with this. Is the treatment that you're doing now, is that going to be providing the best care for your patients? Are you getting the treatment outcomes that you want? And is this going to help your patients in keeping their teeth healthy for a lifetime? So keep that in mind, and I will leave this slide up. There's a QR code there if you guys want some more information on any of our lasers. You have my email there. If you guys have any questions, you guys can shoot me an email or ask Joe. So how are we doing, Joe?
All right. Thank you, Florie. That was a wonderful lecture, fantastic information. A lot of good chatter on the chat, and especially the last 10, 15 minutes here, quite a few questions. So I think you created a lot of curiosity with our group this evening. So let's just spend a few minutes to address some of these questions. So the first one for you, Florie, is was there a charge for the pre-procedure laser used to reduce aerosol worries?
There usually is a charge associated. So I went over some of those with the ROI. It's a consumable, right? You have a tip that you are using. There is a charge, and again, it varies. It kind of varies depending on, what area you're in. But I will say this, I did work in that office that I mentioned in Claremont. It was a very high-end office, but the doctor kept his charge because he was an avid laser user. He had both soft tissue and a hard tissue laser. He said, I want everybody to be able to afford it. So he had like a nominal fee. It was like $20 for LBR, 20, 25, something like that. And his philosophy on that was, I want everybody to have that access. I want everybody to be able to afford it. So he kept the cost pretty comparable to what a patient would be paying if they were receiving fluoride or some other type of benefit. So yes, there is a cost, but it varies. Does that answer the question?
It did, and the gentleman just responded. Great, thank you. So I think you did a good job there.
Okay.
Okay. So question number 2: kindly share your choice of settings for aphthous ulcer, like distance from lesion, focal spot size, etc.
Okay. I start off pretty low. So our Epic Hygiene laser, the setting is at 0.0, it's at 0.7. I usually start about 0.4. I start pretty low. And the reasoning for that is the patient is not numb. So you kind of cycle through the lesion, meaning you do it in stages. And so what you're doing is there's a binary effect that goes on with lasers. And that was something that I had to learn the hard way, which is there's time and there's energy that's going on at the same time. And I was working a lot quickly when I was using the laser because that's how I was used to working with my power instrumentation. So when I slowed down and I took the time, what I found was I used the laser like at a much lower setting. And then when I cycle through, I'm checking in on the patient to see, are they feeling warmth? Because they should feel a little bit of warmth, but they shouldn't be uncomfortable. In terms of distance, I'm usually working at about 1 to 2 millimeters from the lesion. You're never touching it. You're really just hovering right over it. And then, it depends on the patient. So depending on the patient, and then every laser is a little bit different, that might change your settings as well.
Great. Thank you for that. So next question is related to LAPT.
Okay.
So how often can LAPT be performed on a patient, and to what depth can the tip be placed in a periodontal pocket that is over 7 millimeters?
So we do have tips that, and I worked in a perio practice. So again, everybody's philosophy and treatment is a little bit different. We do have tips that extend up to 9 millimeters. So that would be probably the profound depthness that you would have. You can do it repetitively. And I have found that the more you use it, and especially for perio cases, I was seeing better results when I would use it repetitively. So if you worked like I did, where you're working in the deepest area, and let's say it's on the lower right, I would probably work a sextant. Patient would be profoundly numb. This does require a local anesthetic. I scale that area and then I would debride. And then when the patient would come back, let's say I'm numbing another area, and I would retreat the area. So if the tissue wasn't responding how I wanted, I would do repetitive treatments. And usually you get better results if you're kind of scheduling the patients about, 2 weeks, 1 to 2 weeks apart. That way you can see those improved tissue outcomes.
Great. And that person just commented, thank you. So I think we addressed that question quite well. So there are a couple questions I want to address in the chat, and then we will wrap up. And again, to the audience, I will review very briefly how you'll receive your CE unit after we answer these last two questions. So the first one for you, Florie, what happens if the tip is initiated by blood during the hygiene procedure?
So then, so remember we talked about chromophores, and it is seeking out that pigmented bacteria. So there are cases where if you are at a profound depth, the tissue can cause the tip to auto-initiate. So in those cases, you would have to change your tip out. There's some cases where you could just finish up what you're doing, and then, you basically have to change the tip out if it does auto-initiate.
Okay, great. And I believe these are the last ones for us this evening. So any medical history contraindications to using diode lasers on patients? So that's question one from this individual. Question two is, what settings do you use for desensitization? Sorry, couldn't get that out.
Okay. So contraindications, there's not really a lot of contraindications for laser use. I will say that the only caveat to that is if your patient is relying on an oxygen tank and they can't withstand the laser procedure done without their oxygen tank, that would probably be the only contraindication, because the oxygen tanks have to be shut off and be placed completely outside of the op. So that would be probably the only one that I could think of. In terms of desensitization, so for us, for our laser, for our aphthous ulcers and herpetic lesions, it's at 0.7. You can use desensitization in the same manner, where you would cycle through and apply your varnish on that setting.
Thank you, Florie. And I did get one last question here before we wrap up that I want to make sure we address. So First off, they said a wonderful presentation. So mention that. And can you tell me what is the setting for deep pocket 9 millimeters before scaling?
The deep pocket before scaling, meaning so I think it kind of depends on if you're using it, if you're using an initiated tip, meaning you've carbonized that tip and you're turning it into like a surgical component, you are anywhere from about 0.8 to maybe 1.1, 1.2. It depends on the tissue, really. I'm sorry, I can't give you like a clear cut setting. A lot of it depends on the tissue. If the tissue is really hemotrophic and fragile, you're probably going to need less energy versus if it was more fibrotic and dense, you're going to need a lot more energy to go in there. But you do always want to start off with lasers, start off with a low setting and then kind of titrate your way up rather than starting very high and then going down, if that makes sense.
Great information. All right. Well, thank you again, Florie. Great presentation and great lecture.